Hello, is it audible? Thank you. Hi, I am Dr. Sunitha. I am from Vegas Medical Coding Academy. Our academy was established in 2018. I am a founder and also a mentor in this academy since 2018. I am a doctor by profession and I have done my CPC certified course and I'm also done the specialization in Ipdrg and HCC. Today we'll be discussing about what the medical coding is and how is it important in our day-to-day life. What is the importance of medical coder in a healthcare facility and what is the eligibility criteria for getting trained in medical coding and the exam pattern, the curriculum and also the career growth with job placements. Coming to the definition of medical coding. First, we will take two scenarios. One is US based and the other is India based. In India, first of all, when the patient enters a hospital, they will go to a receptionist. The receptionist will collect the doctor fee and send the patient to the doctor for the treatment. But in US, the patient, when she attends a hospital, she will go to the receptionist. There, the receptionist will take the insurance number of the patient. Then, he or she will process whether that insurance is applicable for that patient and for that disease and how much amount is applicable, means how much insurance the doctor or the facility will be getting for the insurance paid by the patient to the insurance company. So the difference between the Indian scenario and US based scenario is, in India we'll pay directly the amount to the doctor, whereas in US the amount will not be paid to the doctor by a patient, but the insurance company will be giving the amount, the claims to the doctor or a health facility. So this is the main difference between Indian and US scenario. Here the medical coding jobs what we are doing in India is totally US healthcare system based, means the large companies where in US they are distributed all over the India, mainly in metropolitan cities. As a small companies, there will be getting placements for doing this medical coding jobs. Okay, coming to the definition of medical coding. Medical coding is nothing but when a patient comes to a doctor with some disease, take for example fever, pain abdomen, vomitings and so, the doctor will ask what the patient has. He will record by audio the patient's symptoms. After recording the symptoms, the doctor will be getting into conclusion to which diagnosis, means lab testings, he should send the patient. After sending the patient to lab testings, after getting the lab testings done, the reports will be brought by the patient to the doctor. So the doctor, after seeing each and every investigation and seeing the symptoms, the doctor will diagnose what the patient has the disease. So here the doctor sees the patient and give the diagnosis. Then after diagnosing, the patient should get treatment to decrease the disease condition. So the treatment will be given by the doctor depending on the diagnosis. It can be a medical treatment or a surgical treatment. In medical treatment, the doctor will be prescribing medicines, whereas in surgical treatment, surgical evaluation will be done. Like it will be from minor surgeries to a major surgery. This is about the treatment and the procedures. What all the procedures, surgical procedures, what all they followed, the doctor has followed also will come into this. And the healthcare services and supplies. Services means nothing but the ambulance service, wheelchair service, and also the equipments in the hospital, like ECG, pulse oximeter, and whatever, so laparoscopic instruments, this all, even the syringes will also be given code in medical coding. So nothing but the definition is nothing but transforming or converting healthcare diagnosis, treatment, procedures, and also services into a standardized alphanumeric codes. Alphanumeric means alpha means alphabet and numeric means is the number. So the codes will be in alphabet and also in the numericals. So the definition is medical coding is nothing but converting healthcare diagnosis, treatment, procedures, and services into a standardized alphanumeric codes. So we will take one example. A patient will be having a diabetes. So what code we will give? In ICD, ICD is nothing but International Classification of Diseases, 10th revision. In ICD, will be getting the codes for disease. What the patient tells the doctor, what is the condition, what is the symptoms the patient have about the disease to the doctor. So in ICD we will get diseases. So here the example is diabetes. Diabetes is a disease. So we will be giving the code E11.9. E11, E is alphabet, 11.9 is numerical. This is alphanumeric code. That is, the medical coder will give this code for diabetes mellitus. It comes under ICD-10. These all things I will be explaining you briefly after 10 minutes. Then then comes the doctor if he performs appendectomy. Appendectomy is nothing but surgical removal of appendix. Appendec means appendix. Ectomy means in medical terms it is removal. So we'll be giving the code from CPT book. CPT is nothing but current procedural terminology. So these codes will be all 5 characters will be in numeric only. In CPT we will get codes only in numericals, that will be 5 characters. So these are the 2 examples. I'll be giving the remaining examples also. This medical coding is important because the medical coder forms a link between insurance company and also a health provider, means a doctor or a health facility. He is the main person to give amount to the doctor by an insurance company. So these codes are used for billing and data collection. See, now a patient comes, an inpatient, for example, you take so much progress sheets will be there, some hundreds of sheets will be there. So to concise that thing, we will be giving codes so that hundreds of pages will be decreased to some 2-3 pages, and this will be stored in a software that is called data collection. And also this coding also used for healthcare analytics. It is nothing but healthcare analytics is a research purpose, means a patient if he gets a disease in that area, why the patient has got the disease in that area, what is the risk conditions, and how the disease can be treated, what all the things on the patient we can do, that is healthcare analytics. It is used also for this medical coding is also for research purpose. Can you understand? Okay. Why is medical coding needed? Just now I told you we can give an accurate billing. See, in medical coding each code will have some dollar rate. As such, in India, depending on the doctor, they'll be taking the fees and the amount for surgeries or something treatment. So here in US, a code will be having a particular dollar rate, so we can get an accurate billing. So the doctor will not be in loss, either company also will not be in loss. There will be accurate billing and also insurance reimbursement. It also maintains standardized patient records. I told no. See here, I will tell one example. Now patient tells the doctor so and so problem was there. The doctor will be giving treatment for that problem. The patient, if the same patient goes to some other country, there the language will be different, everything will be different. The doctor will be not knowing what the treatment has been taken by the patient, and also what are the signs and symptoms of the patient. By giving this medical code, as it is universally accepted, wherever you go, if you see that code in whichever country the code belongs to a disease, that disease will be universally acceptable. So the doctor can know what the other doctor has given the treatment or what the patient is suffering from. That is called standardized patient records. And it also helps in research purpose, like analytics I have told, no, that one. Then it decreases the frauds and also denials. See, in fraud means a particular code is there for a particular disease, so he will be getting a particular dollar rate, so they can decrease the fraud and also claims denials. By giving the wrong code, we can, by giving the correct code, we can decrease the claim denials. And also used for healthcare policies and also decision making. This is the importance why we need medical coding in day to day life. So see here, I will tell you about these things. Workflow of the patient to claim means this is called revenue cycle management. Revenue cycle, that itself says that we will be getting the amount, we have what the patient has to pay to a doctor. It will be generated through this cycle to the insurance company. Then the insurance company will be giving the amount to the doctor, that is the healthcare provider or a health facility. This is nothing but a revenue cycle management. See, it will be like this. Patients visit a receptionist. The receptionist will check the insurance, and if he is eligible, he will be sending the patient to a doctor. Then the doctor will record every symptom what the patient gets and also the investigation what the patient does. So he'll be recording. After recording, these recordings will be going and he will be diagnosing, and for the treatment he will be telling. After recording this, the recording will be given to a medical transcriber. Here the transcriber's main role is to convert an audio into a written language, through this written language. The medical subscriber will give it to a medical coder. After giving this to a medical coder, the coder will translate that language into a coding language, that is nothing but a medical coding. Means this disease will be having this code. He will be giving the codes for the disease or lab investigations or the treatment procedures, supplies, everything. He'll be giving a code which is universally acceptable. So after giving the codes by medical coder, then this codes will be given to a insurance company. See there, the insurance company people, they will see whether that codes are correct or not. If anything is wrong, the codes will be going to a denial management. Management is nothing but when codes are given wrong, so the amount what the doctor gets or the facility what he gets will be less or more. So to decrease that thing, that wrong things, that is fraud, it will go into denial management. In denial management, nothing, they will see the codes and they will tell that medical coder that codes are wrong, just please once again check the codes and give it to processing department, and then the insurance company will be given the amount to the healthcare provider or health facility. This is totally a triad. 9 means a pair, means a patient, it will be between a patient, a doctor and an insurance company. This is a triad. Revenue cycle is a triad. It moves between the three things only: doctor, patient and an insurance company. So this is the workflow for revenue cycle management. And that after paying the amount to the health facility, that records will be stored for audit purpose also. This is the workflow for revenue cycle management. So till now I have told you about the importance, definition and the revenue cycle management. Now coming to the main important topic is the codes. What all the books do we follow in medical coding? There is 3 types of books what we follow. One is ICD-10-CM. ICD-10-CM is nothing but International Classification of Diseases 10th Revision Clinical Modification. So the word itself says it is internationally classified diseases. The diseases all over the world will be given codes in this book. The disease, it can be a disease, it can be a disorder, it can be an injury, or it can be a cancer. Anything symptoms related to the patient, what the patient tells a doctor, will be giving codes in ICD-10 CM. Understood? Okay. The main important thing in ICD-10 is nothing but ICD-10 is purely it will have minimum of 3 characters and maximum of 7 characters. 3 characters to 7. So in this the main important thing is the first one will be an alphabet. Here the remaining characters will be numericals. First is alphabet, and by seeing that alphabet we can know how many system, which system it belongs to, the disease belongs to which system. So in ICD-10 our body is having 11 system. So each system one alphabet will be there in ICD-10 CM. So everything will be seen, the diseases, disorders, injuries, fractures, and also cancers in ICD-10. So this is one book we'll be following. Then the other book is CPT. CPT is nothing but Common Procedural Technique. The word itself tells that the procedures will be in this book. So what the doctor tells the patient, that is the treatment and investigations and the procedures, surgical procedures will be coming into this book. So this book comprises of codes for procedures, that is from minor to major procedures, and also lab investigation, nothing but blood test, urine test, pathological findings, next x-rays, ECG, CT, MRI, these all things, investigations and procedures will come under CPT book. CPT, one important thing is CPT is mainly or comprises of 5 characters. 5 characters, whereas ICD is 3 to 7 characters. In CPT, we will be having 5 characters. All characters will be in numericals only. The difference is here all will be numericals. So here for example, if you take an office visit nothing but when the patient visits a doctor, like the outpatient, he will be giving a code as 99213. Like this office visit, inpatient also will be there. In inpatient visit there will be emergency department visit also, critical care visit also will be there. So each and every code will comprises of 5 characters. So in this book there will be procedures and also the investigations codes. Next comes the HCPCS. In this is nothing but Healthcare Common Procedural Coding System. Here in this the supplies what the doctor uses from the facility can be a wheelchair or ambulance or drugs like medicines, injections, everything will, even the small thing, that syringe and the syringe needle will be having code in this HCPCS level 2. So it comprises of supplies, drugs, and non-physician services. Non-physician services is nothing but ambulance, wheelchair, and etc. So the main important thing is HCPCS. It is comprised of 5 characters. 5 characters like the CPT. But the main difference between CPT and HCPCS is, in HCPCS the first one is an alphabet and remaining 4 are digits. Okay, fine. So see here example J1100. This is injection dexamethasone. This is about HCPCS. So these 3 are the books we will be teaching you in our training. These are very easy to remember. No need to memorize also. Just you can see the book and can give the codes. So as I am a doctor and a gynecologist, I am having 15 years of experience. I will be making you perfect in seeing the book and giving the codes. It is very easy for you to learn. If you are having doubts also, I can tell you very deeply also. Very easy to remember also. No need to remember the codes also. Just you can see the book and you send code. But in companies you will be having a software. The software will, if you mention the disease or procedure, the software will show you the code. So no problem, no need of having the computer knowledge also for this medical coding job. After joining a company, they will be giving you 2 to 3 months of training. about this medical coding. After giving the training only, they will introduce you for the job. Means they will be giving you the progress sheets to give a medical code. So in nowhere for you there is use for memorizing the codes. So then next comes the DRG. DRG is nothing but the inpatient department. No need of learning here in DRG. So I told you everything about the medical coding, the importance, definition, revenue cycle management, and also now coming to the weightage of marks in CPC exam. So you will be having, it is totally completely online based exam. The marks is out of 100 marks, you have to score 70 marks. 70 marks is the percentage. And the main important thing is it is open book exam. Means the books will be, the 3 books what I have told, they will be kept on your table beside your desktop, so that you can see and give the codes and answers. This is an open book exam. That is the main important thing you have to know about this exam. And the exam will be also very easy, because I myself will teach you. I'm a doctor, I myself will teach you in depth and very easily during the training program. So it is an online computerized based exam. You are having centers in Hyderabad, Bangalore, Kerala, Chennai, but near to us is Hyderabad or Bangalore. So we can go there and we have to give a computerized based exam. See, so many weightage will be first in the surgical. This is 10,000 series, that is 6. 20,000 series, it is 6. So depending on the systems, we will be giving this marks. And evaluation management, anesthesia, radiology, lab, what I told, medicines, this all comes under CPT book. So maximum marks you will be covering in CPT book. So if you get thorough on CPT, maximum marks you will be getting from CPT. You will be passed in this exam. So many batches has passed out from our institution. They have got 80 plus marks. They are well settled in their career in big MNC companies. The remaining medicine, medical terminology, anatomy, ICD, this all things will be telling, but of less marks. So this anatomy also will be teaching you, and medical terminology also will be teaching you in depth. So no problem with anatomy and medical terminology. Anyhow, these all things will be there in your book, and the exam is open book. So no problem for you to write the exam, as it is an open book exam. So coming to, I have already told you that ICD-10 CM coding, it is international classification of disease, contains 2 to 6, 7 numbers. It is divided into chapters. So number of chapters, 11 system. We are having 11 body systems. It is divided into 11 chapters. So this is about ICD. And then coming to CPT. CPT, I have already explained you, it consists of 5 characters. All 5 characters are numerical. It is composed of procedures and also the investigations. So these are divided into 6 sections. Evaluation management, anesthesia, surgery, radiology, pathology, and medicine. This comes under CPT. And the other one is HCPCS level 2 coding. Is nothing but non-physician services and supplies. For example, I have told you na, wheelchair, medication, injections, ambulance services, etc. It contains alphanumeric format, 1 letter and 4 digits. Example A0429, ambulance service and basic life support. The other is J1100. So this is dexamethasone injection per 1 gram. So for 1 gram, J1100. So what all things you have to learn about this in medical coding is, one is anatomy, medical terminology, and the 3 books. It will be easy for you, as I am a doctor. I will be teaching you, and I will be giving you clarifications on your doubts till you settle in this medical coding job and till you improve your standards. And one other thing, important thing for us is, we have created a job means WhatsApp group for medical coders. So in this we will be posting about the placements also in that group. We will be giving 100% placement in job, and also pass percentage also 100%. So job placements will be 100%. We'll be uh, telling about the jobs, what all jobs are there in that WhatsApp group. You will be having a home based, means like you can work from home also. Some companies they prefer work from home. They'll be working flexibility timings also. You can work as a freelancer also. You can go out of India abroad to get the jobs also nowadays. So many doctors are there, but the diseases are more, patients are more. So what all the things, the diseases, everything is, the insurance company can't study each and every point and give the amount to the doctor. So here, so medical coders should be more for giving the codes. So the importance of medical coding has been increased nowadays. So coming to the topics, medical terminology and anatomy, this will be telling you in depth regarding during the training. The CPC exam overview I have already told. This is affiliated to American Academy of Professional Coders. Means the certificate what we get is from American Academy from US. This is not Indian based exam. It is purely an American based exam. The time duration is 4 hours 20 minutes. Here the 20 minutes is for checking your data, biodata. So 4 hours is the exam time. There will be 100 MCQs, only MCQs. There is no negative marking in this one. 70% is the pass percent. This is an open book exam. Open book, it consists of 3 books: ICD 10 CM, CPT, HCP, CS. These books are allowed. They will be keeping on the table for writing the exam. The tests are real world coding accuracy and guidelines understanding. This is about the exam overview. Then comes the sample questions in CPSC question. See here, the 45 years old male undergoes excision of benign skin lesions on arm. So skin lesions. So we have to see whether that is benign. Malignant also will be there. So here we have to see the size also, on which part also. This comes under CPT. They have asked about CPT code. So CPT code is all 5 are numericals. So we'll be deleting one by one. So the correct answer will be B, that is 11402. What is the difference between 11401 and 11402 is everything is same. Excision, benign lesion including margins, but here the width, the length is different. See, in first one it is 0.6 to 1 and the second one is 1.1 to 2. That is the difference. So little minute things also we have to see in these books. And what are the common mistakes is, we will here in this CPT every book will be changing every year. New codes will be added, some codes will be deleted and some codes will be revised. So if we are ignoring the guidelines, then there will be confusion between excision, biopsy. So these all things will be there, but we will be telling this in during our training. And time mismanagement, these are things, overlooking the modifier, these are the common mistakes. So the curriculum is from our academy. First 2 weeks we will be telling you about the ICD 10 CM, that is basics about the disease codes, and also will be giving mock test. Will be conducting mock test after each and every topic finishing. Then week 3 to 6 we will be telling about the CPT and also HCPCS. CPT is the main important scoring subject in medical coding. Almost 75 to 80 marks, 75 to 78 marks we will be getting from CPT. If you get thorough with the CPT book, then you will be passing the exam with 80 plus marks. And the 7th week we will be telling about the time management skills, how to manage time, how to get a correct option in in multiple choice questions. And the 8th week will be totally of revision and final mock. Means from all the 3 books we will be giving the mock test exam questions and will be preparing. After seeing your result in mock test, we will be guiding you when to write the exam. In between the training also we will be giving you the interview questions. We will be preparing you simultaneously for the interviews also. This is the main important point of difference between our academy and the other academies. In other academies they will be teaching you, they will be giving you only the training, but here we will be giving the training, we will be making you trained in interviews, also we will be building the resume also, and it is 100% job placements will be there in our academy. And the main important thing is me myself, I am a doctor. I'll be telling you in depth about everything. So this is the main difference between the other academy and our academy. And what are the career opportunities after CPC certification? After certification, you can work as a medical coder or auditor or billing specialist also. So medical coder is the initial career thing. Then after getting a service of 1 to 2 years, you will be given as an auditor. After auditor, you will be getting as a billing specialist. Here the coding train, I have told you, in some companies, for 2 to 3 months the trainer will be there for teaching you. He is nothing but the coding trainer or a compliance officer. You can work as a research for, you can use this medical coding for research purpose also, and also for documentation specialist, where all places you can work as industries like hospitals, insurance companies, research centers. You can work as a freelancer also. So many career opportunities are there for medical coding. What are the, so this all things, the what particular things, what all I have said, what all the bits you have to follow, you can see in our website. This is our website, www.vegasacademy.in. You can go into this website and you can search our curriculum also. So these 3 books will be followed in our training purpose. Thank you for patience listening. Any doubts you can ask. I will show you one real time example. Thank you. Any doubts? Thank you.